We are live and all set to go.
Okay, we'll call the meeting of the Town of Northborough Board of Health to order. It's August 10th, 2021, 6:05 p.m. We'll start by taking roll call. When I state your name, please just say present. Dilip Jain.
Present.
Swati Sane.
Present.
And Teresa Capabianco.
Present.
And of course, we have Kristen Black, field agent. With that in mind, Ms. Black, I'll ask you to please read the governor's message regarding our public meetings.
Thank you, Mr. Chair. Again, this is Kristen Black, Health Agent, Town of Northborough. This open meeting of the Northborough Board of Health is being conducted remotely, consistent with Governor Baker's executive order of June 16th, 2021, an act relative to extending certain COVID-19 measures during the state of emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to the Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment, and you can do so by raising your hand in the feature of the chat, or in the, raise hand feature on Zoom here. And if you're having any issues trying to gain access to comment, you can send an email directly to me at kblack@town.northborough.ma.us. Thank you, Mr. Chair.
Okay, very good. So first item on the agenda is the approval of the July 13th, 2021 meeting minutes. Has everybody had an opportunity to review them?
Yes.
Dr. Sane?
Yes.
Very good. And are there any objections or corrections from anyone on the board?
No.
Dr. Jain?
One question. I think for consistency's sake, we want to, on the last paragraph where we reviewed the meeting at the end, I think it was 6:54. My name is put Dilip Jain one place and Dr. Jain as another place. I think we want to be consistent throughout the thing by using either first and last name as opposed to Dr. Jain. I think that would be fine.
Okay. What do you prefer?
Dilip Jain is
Dilip
fine.
Jain is fine.
For
Well, just
the
Dilip
official
Jain.
record.
Now on, we're going to lose all the suffixes and just go with that. All right. Aside from correcting your own name, are there any other additions, subtractions, or no? So then I move that we approve the meeting minutes of July 13th, 2021. Can somebody second that, please?
I'll second it.
Okay. And all those in favor? We're going to do the roll call. Dilip Jain.
Aye.
Teresa Capabianco.
Aye.
Swati Sane.
Aye.
And myself, all unanimous. Very good. Moving on to the next item on the agenda, COVID-19 update. I will turn that over to Kristen Black, please.
Thank you. So I think we're seeing, the same trends in Northborough that are happening statewide. We're starting to see an increase in cases with the new Delta variant. So over the last 2 weeks, I just ran a report. We've seen about 15 cases in 2 weeks, so about 1 case a day. So we're really back to those spring numbers. The age ranges are really all over the place. You know, a lot of people think that kids aren't vaccinated, it's just kids are the only ones getting it. You know, unfortunately, that's not true. We're seeing both unvaccinated individuals get it, and we are seeing some cases of breakthrough, which is not all that surprising, considering just our overall population is so well vaccinated. So we're going to see numbers just because of the proportion of the population. So again, we do have some cases of breakthrough. They're I would say less than half of our total cases. And you know, if I look at the last 2 weeks, we really didn't have many young children. I think it was ages 13 to 81 in the last 2 weeks. The week before that, we did have 3 childhood cases that were unrelated. So it's sort of all over, you know, where we saw, so representing all age cohorts, and no big clusters or anything like that we needed to deal with. But statewide, we're just seeing that uptick in numbers with the Delta variant. So as we're looking at that, the trends, we also want to make sure that we are ready as a community to react and have good testing. So the one thing that's a little different with the Delta variant, and we can let the medical doctors can go on and talk about it more, is that, you know, unvaccinated people can transmit the virus. They're finding that they have the same viral loads with the Delta variant, both vaccinated and unvaccinated, in the upper respiratory tract. So we are seeing some transmission. So it's important for everybody to consider symptoms and to seek testing when appropriate. And so what we're finding is that the state's testing centers are getting a little overwhelmed. The Project Beacon site, for example, that's been great in Framingham. That's one of the express sites. You know, they've had a little bit of a backlog, which we haven't seen for a while. So one of the opportunities that's available to local boards of health is the Abbott BinaxNOW antigen kits are given out for free. And they want local boards of health that are encouraged to accept those BinaxNOW antigen kits to offer testing for town employees and others. They don't really give us a best practices of when or how. They're just saying these kits are available. They were offered to recreational camps this summer. These BinaxNOW kits are being touted by the state as a useful tool for schools. They're talking about, you know, test to stay and some other programs where even if a vaccinated or individual was exposed to someone who had COVID, they could stay at school, but want them to take the test every day. So all of the, you know, best practices and how to use these free Abbott BinaxNOW, which is an antigen kit, those best practices are being developed. So there's a big call with DESE, I believe later this week. They're going to talk about how the schools is using it, but it is a tool that's available to towns to use for employees, et cetera. And then the other thing that was mentioned in the agenda is the Abbott ID Now, which is a rapid PCR test. And so I did go visit the town of Ashland, and they've had one of these kits. They run it through their town hall, and it's a great tool where you can get those instant PCR results. So the day I was there, seeing this machine be used at their local board of health, one of their workers in town had called up. He'd recently traveled to Florida, had symptoms, and called up and said, you know, I have some symptoms. Can I get a test? Or I'm trying to figure out if I can get back to work. And they did the test the day, you know, I was over there, and the test was positive, and they were able to immediately, you know, keep him home from work, isolate him, and to avoid, you know, their core services being impacted with exposures at the workplace. So this, the BinaxNOW is free. Local boards of health can request it. There's a few things you need in place for it, which is you need a CLIA, which is associated with like a lab approval, because if you do testing, it's really important. You have to report it to the state. So that's really the key thing, is we upload that data to Maven. The Abbott ID Now testing, it's the machine itself, at least when Ashland purchased it last year, was around $5,000 with $40 of PCR kit, like per individual test. And so what I've been talking to the town manager about is just that we would like to have testing options in town in the event that we're seeing this uptick, because we want to get people back to work. We want to be able to isolate people who are sick and do contact tracing and really reduce the spread. Most importantly for our key services like fire, police, but also to keep teachers in school. The schools are not pursuing a rapid PCR machine. That would be something that the town could handle with their new nurses that are being hired through the contracted nursing services. So one thing that we'd be doing is that it would be the Board of Health applying for this lab approval. I talked a little bit offline with Dr. Sane already about like storage and handling it. And for the kits, the location would be Lower Town Hall in the old food pantry. We do have a space there and it's great. And that the public doesn't access it and it has its own separate door. So we could do swabs outside with the nurses, keeping anybody who is sick or symptomatic outside of the building. So there'd be no one with symptoms inside, but it would give us that ability to offer testing on site. And I hear that from, I think Mary Ellen Duggan mentioned that in Sudbury, I believe their fire department has also offered this ID now. So I'm waiting back from some details on the vendor, but I really was just looking for the Board of Health support or thoughts about the testing and having that ability. We would need, again, the lab approval and then standing orders from a medical doctor to be able to order those. And so
I think it's a good investment for the future.
How many testing kits are available each week? Is there a set, like, is there a minimum or?
No, I think with the Binax now, the antigen kits, the state just, they hasn't said, it sounds like you can order unlimited amounts, like everything from screening. I haven't heard of any caps. You know, maybe at some point, I'm not sure. With the ID now, I know that the test kits come in increments of, I think, 24 in a box. So you're ordering 24 kits at a time. They do expire. So, you know, you wouldn't want to pre-order 500 and have them sitting in a closet. So most of the, you know, the other towns that are using them just order them in increments and sort of see how much they're using them. I think in Ashland, similar size community, they've been running it since October and they do about 50 tests a month of the PCR rapid. So, you know, they've done, I think it's been about 10 months or just over 500 results so far.
Is it going to be restricted to residents of Northborough or anybody that wants it done?
I would start piloting it with just town employees, focusing on all of our workers in town to keep those essential services in our teachers in that place. I think if we were to get so big right now without like a full staffing and more of a plan, you know, it just families and other residents, you know, it could become overwhelming, you know, or it could be, you would need to staff it full time. You know, what we're looking to do is to say, we have the space, we have the nurses that can dedicate, let's say, an hour or two to testing a day. We can also train, you know, other house staff. They don't have to necessarily be nurses, but we need to make sure people are trained. So I think what we'd be looking for, at least a reasonable start, is just employees. I know in Ashland, they focused on employees. They have had situations where they get a call at the local health department, you know, a family emergency, a death, I need to get on a plane, I can't get this result, can you help me? And they've helped in extreme circumstances like that. We do have fairly good testing, but emergencies do arise where people need a test result. So we just want that ability to possibly serve the public, but really starting off with probably just focusing on employees and really seeing how well it works and the demand, but keeping teachers in school, you know, and not having them, you know, substitute teachers in play while, you know, they're waiting 3 days for a PCR test result, you know, is sort of the goal.
And this is,
Sorry, Glenn.
is this just for rapid testing?
Yeah.
This machine or what we're talking about here?
Yeah, so this is PCR. So this is the gold standard, you know, and it's
right.
rapid. It's 15 minutes. So it's in the machine. It can give a result as quickly as 5, but it's very quick.
And as far as reliability goes,
They're
is it on
pretty,
par with
yeah,
the other?
yeah, they're fairly reliable. You know, it's the same hospital grade used in laboratories. I mean, none of the tests are FDA approved. They're all EAU authorized. I mean, that's across the board with all the tests. So it is, you know, it is an EAU approved emergency authorization for testing. So they're falling into that category.
Teresa?
Sorry, thanks.
Thank you.
How are we paying for this? Does the Board of Health have funds left in its budget to do that? Or is the town paying for it? Or are we thinking that we might need to be passing something on to the citizens who use it at some point?
So for now, I think we're just focusing on employees, you know, as a start. There is, I believe we have funding left in the CARES Act. And so it wouldn't affect the taxpayer, other town budgets or anything. And CARES Act is a use it or lose it, and it's expiring in October. So part of it, when I heard of that, we had some of this funding that may be available, this seemed like a great use for it. What this means down the line, and if there was an increase in demand, or we would expand it to residents, you know, and whether or not we need to do a reimbursement or where that would go. But for now, it would be just focusing on the employees, all funded through CARES Act. So it wouldn't impact any town budgets, and it wouldn't take away from the schools or, you know, anything like that.
Perfect. All right.
I mean, we're working closely with the schools. The whole idea is we would support the schools with this. So CARES Act is for the town. So that CARES Act funding that expires again, I believe in October, it sort of is given to the town and how you parcel that out between school testing, et cetera. So we'd be looking to support them. So it would be a benefit for both, you know, school and non-school employees and departments.
Okay, thanks.
Hi, Kristen. Sorry to interrupt. There is a hand raised in the public, but I'm unsure if you're taking public comment at this time.
I'll leave that to the chair.
Well, I think we should entertain a public comment.
All right, absolutely. I'll allow them to talk. And Jody, you are able to talk now. You are on mute.
Okay, can you hear me?
Yes.
Yes.
Okay, so my question is, recently the CDC came out and said, and if you go on the website, you'll find this, that the PCR has not been able to distinguish between the COVID and influenza. And as of January 31st, 2021, labs will have the option to choose from a number of different types of tests to use. So the PCR actually could never determine the real COVID. So I'm wondering how it's determined that there actually is this Delta variant. This is important because people keep saying that there's a Delta variant, but then the CDC said that the PCR test doesn't even distinguish between influenza and COVID. So I don't know if any of you have seen that recent announcement by the CDC, any of the medical doctors. You might want to look on the CDC website because it's blatantly there stating that as of January 31st, 2021, there's going to be a lot of choices for labs to use for testing purposes. So the PCR was never able to determine COVID to begin with, and I know it's widely used all over the world. But again, it's one of those things that the CDC says and then contradicts itself. So as a small town, we really need to be aware of what we're doing if we're spending money and putting people through hell. So I don't know if anybody has any response to that.
I think we'll have to look into that, Jody. I haven't seen that particular information from the CDC.
Okay, I
I
can
just
send, I'll send-
comment that the PCR test, the polymerase chain reaction is very specific. It can detect COVID separate from influenza, but there isn't a way to detect the variant with this type of PCR testing. So we could determine if there is evidence of infection with COVID. The influenza kit through Abbott is a whole separate kit that can test for influenza A and B. I believe it's the same machine, but it's different cartridges. That's how the test works. But it wouldn't detect the variant. But I could look for that if you want to forward that to the health department. I have not heard any that CDC reference, and I would be happy to look into it further.
Okay, yeah, I'll forward you. Should I forward it to you, Kristen?
Sure, yeah, you can use, if you go on the town's webpage, there's a contact form for just the general
Yeah.
health department, and that will get to me and we'll take a look.
Okay, and the PCR test is not specific, just so you know, it is not specific. So, but you'll find that out when you read this, I believe. So I'll forward that on to you. Thank you.
Thank you. Well, hopefully they'll get the scientists will get better at what they're doing. But we have to work with what we have available this time. So I think it's a good idea. That's my opinion. Dr. Jane, Dilip Jain, what do you think about it?
Well, Glenn, I think to your point, right? This is all we have, so we have to go with what we have. I believe, again, because this is like a SARS-CoV illness, right? And not knowing the exact details of the laboratory testing, I believe this is more specific towards this one. Because we generally, for the flu, this thing, it's a rapid testing, but I'm not sure that cannot test between A and B specifically.
Right.
But when they go to the laboratory, they can, test it specifically there for A and B for influenza. But if I'm not mistaken, and I have not seen the CDC thing that, the person was saying, the audience was saying about, not specifically for flu versus COVID. I have not seen that yet, unless Dr. Sania has seen something.
No, I agree. I haven't heard anything about, false positives
Yeah.
with, flu. Haven't heard that. I thought PCR was always more specific.
Yep.
So,
Well, I
but
guess
yeah,
when we-
I'll look into that. I can check
When
the
we get
website.
the link, we'll take a look at it. We have September before that America Cares Act closes down. They'll probably extend it anyway, but I guess we'll have to look into that further. But I think some sort of testing that we could run for the town. I mean, if you have influenza or COVID, either one, and this thing comes up positive, I guess you better stay home.
Yeah. And Kristen and me had discussed about even doing influenza testing if possible on site, because during fall, winter, the symptoms are so similar.
Right.
So it could be one or the other. And I believe you said that can be done, right? It will be just 2 separate swabs, 2 separate kits.
Oh, is that how it works, Kristen? You get 2 separate swabs and
Yeah, it's a separate test, but I believe it's the same machine. So I'm waiting
Okay.
to hear back from the vendor, but we could definitely look to do that. I don't, if you could rule out COVID, then you could check for influenza. But I think I did have email back and forth chain with Dr. Katie Brown, the state epidemiologist. And, when you're testing and you're looking at symptoms, you really need to consider the viral load of, are we seeing high transmission of flu at that time? Are we seeing high transmission of COVID? And so your testing or what test you would lean towards is going to depend on what's happening in the community. And so having that flexibility of the influenza A and B test through Abbott with the same machine could be really helpful if we do end up with a big outbreak of flu.
Teresa, any
So,
thoughts?
just a couple. While Jody was speaking, I quickly Googled CDC website, PCR, and there's a factchecker.org article about how some of the information from the CDC's website regarding PCR testing being confused with influenza has been misconstrued through social media. So I think a little more background information on this is necessary, maybe by professionals who delve into this kind of stuff every day, before we jump off the bridge. But overall, I think the idea of bringing the testing in and utilizing that CARES Act money is a good idea, especially if we have some left and we don't have it allocated to some other specific need.
Excellent. Okay, anything further on the COVID-19 update? Oh, is there any underlying sort of common denominator for the breakthrough cases that we're having, Kristen?
No, the state finally just today reported a little bit more on breakthrough cases and different vaccinations. And it really, Moderna showed the best with the state's most recent data. I think next was Pfizer, but again, the overall breakthrough cases, we're just seeing, I'm pulling up the numbers now. Overall, it's just 0.23% of vaccinated people are having breakthrough. So again, less than 1%, 0.23%. So it is very low. All the vaccines are performing very well against breakthrough. So Moderna was reported at 0.16%, Pfizer at 0.24, Janssen at 0.55. But we've seen it all. I mean, I've seen cases of breakthrough where it was a medical worker who was vaccinated really early, and you think maybe, their immunity was wearing out. And then we've seen people that were vaccinated with their second shot 1 month before, and they become reinfected. So it just seems more to be a factor of your exposure. We've seen, breakthrough cases where, it's people, a whole household is sick, so you're exposed to the virus all day, and much longer exposure. So no rhyme or reason as to who, when, why. They're still collecting that information. So
And one last thing I have on my mind about COVID is booster shots.
Hmm.
So I got to bring it up. What are our thoughts on the booster shots, and what do we know and what don't we know?
Yeah, so I mean, there research is out there. Some of the pharmaceutical companies, Pfizer, Moderna, they're boasting. You might see the recent post on Moderna that booster shots are needed before winter. However, I think the CDC has consistently stated that they're not recommending it at this time. So we're not ready to jump ahead. And even if you wanted it, because Glenn, you thought it was going to be the right thing and you want to be uber safe in Massachusetts, we can't give you one. So it's not authorized. So I think at this point, we could just say, stay tuned. The CDC, DPH is following along. They're not issuing boosters or mixing of vaccines you're hearing of in some other countries, where they're getting one shot of one. And I've heard of people that received the one shot of J&J saying, wait, now I want a Pfizer. Can I double up? And right now the answer, at least in Massachusetts, is no. It's not authorized, and a medical provider can't do that at this time. So unless, I don't know if you have anything to add, Swati, or do
No, you're right. So
You're
far,
right.
no booster is indicated, though Pfizer also wanted to give the booster shots in August.
Yeah.
But the CDC, FDA did not think it was necessary. I think they're waiting more for the studies, more and more studies to come out on those who were vaccinated end of December through February. So probably November, December, along with the flu shot.
All right.
So one last question for you all on the COVID-19 update is the state does offer for both schools, local boards of health, businesses in town. They can request a mobile vaccination unit to go to a workplace, to go to a school, to go to an event. I have a colleague in Milford. They had their town's big fair or festival, a carnival, and they called the mobile unit, and they were present at that town event. People can just walk in and receive a COVID shot. It's much easier than when we ran our regional clinics because they are doing the ordering, the handling, the staffing. And so one conversation I had with the town administrator's office is, we have the big Apple Fest is around the corner, which is a large town event, lots of people. Whether or not we would partner, maybe even at the fire department or elsewhere, but the Board of Health and the health department could work to have the mobile vendor present. I really don't see a downside because it wouldn't be, the town wouldn't invest any money. We can just request it. And so I didn't know if that's something, I hear two sides, people say, make it convenient, make it right where people are, make it social. And they really are encouraging health departments to continue to work towards vaccination. We have some of the best rates around, but our 12 to 15-year-olds, they're 78% fully vaccinated. Our 16 to 19-year-olds and most of our other categories are all over 95%. So there's still the 5%ers in every age category. And we have 22% in the 12 to 15 that still aren't vaccinated. I know it's available at CVS, it's available at Target, but there's the, discussion of, or Wegmans, or, there's so many other businesses around here that are offering it. But I was considering whether or not we could build that into not disrupting Apple Fest, but offering that through the health department, that we'd have a vaccination available. There's also some consideration where other towns have done incentives, gift cards or other things just to encourage the public, and that's a whole nother question for finance. I believe those were funded through FEMA. So just looking for a poll from the Board of Health. If you're interested, I think that's a good idea.
Well, there's no downside to it other than we'd be pulling that mobile vaccination truck away from somewhere else that maybe
Needing it more.
there's more people willing to jump on the truck wagon, so to speak, and get vaccinated. I don't have an opinion one way or another on that for some reason. It just, is it really necessary? Our numbers are really up there. There's mostly little kids, as far as I know, go to this Apple Fest. You know, I don't know.
I mean, Kristen, I guess my thing would be is instead of at the Apple Fest, it might be best to have the van at the middle school, right, for a week or whatever it is, because that's where your 12 to 15-year-olds are, right? You know, if it's 5 to 7% of the general population that hasn't been vaccinated, you know, they've got ample opportunities elsewhere. And, you know, to Glenn's point, there may be other towns and communities that may have such lower rates of vaccination than ours does, that it seems like we might be I agree, it's only for one day or for a few hours that time. But I still think that probably the bigger bang for the buck would be at the middle school. You know, have the van out there in the middle school, because that's where the 12 to 15-year-olds are going to be, assuming they go back in person learning come September. I mean, you know, that's also the big assumption, you know, what's going to happen there. But if they are, then that would be the place to get them. You know, of course, they'd have to have the parental consent and the whole thing. But I would think that would be the bigger bang for the buck, so to speak.
Yeah. I don't know if you're going to get anyone during Apple Fest to jump on though and get a shot.
I'm
just don't
enjoying
see
myself and I'm going to get a shot. I don't think.
No.
And, you know, if the kids are with their friends and the parents aren't there, you can't vaccinate them
Right.
at Apple Fest.
Right. Oh, park down the skateboard park. Grab those little rascals down
Yeah.
there. I don't know. I have no opinion on that for some reason, one way or another. I think we have enough places in town that to have it at the Apple Fest is really not necessary.
I was at a concert on Saturday night up at Lowell at Boardwalk Park, which is a small outdoor venue, and they actually had a vaccination clinic there, and it was pretty quiet. I don't know that any, it was like an all ages show, so there were some younger kids there, but I don't know that they had the numbers that they thought they might have. But for Lowell, they just want to make it available because their vaccination rates aren't the same and they're a much larger population. You know, I think if you're inclined to do it, probably I would think the best event might be the fireworks event during the hour when the barbecue's there, because normally the families show up for that. So you'll get those teenagers with their parents there so they could get that consent in place. That might be if you were going to do it, that's probably the best time, because the only other event where you're going to draw a pretty huge crowd is the beer tasting barbecue, which happens earlier in the day, but you've got mostly adults only going to that. That's the vaccinated population. So
that's a good idea. And is someone going to do it at the, you know, getting ready for the fireworks? I guess you're sitting around not doing anything, you know, waiting for the sun to come down.
Right.
All right. So if we go forward on that, I think that's an excellent suggestion. We'll go right with the fireworks.
Okay, well, I'll look into it
Or
more.
the bouncy house.
Yeah. I'll look into it more, and I'll reach out to the health director in Lowell and just see, you know, sort of what they've learned from that experience, you know. So the state is encouraging communities to try it out. You know, I think, you know, it's not a lot of bang for a buck, but it's continued messaging on vaccination. So, but I'll reach out to Lowell and see, and I think that's great feedback, Teresa, for maybe that's the best location of focus during that window.
Good.
Thanks.
Okay, then we'll move on. 101 Colburn Street. Discussion of the condition of the property and possible declaration decision regarding public health nuisance. A vote may be taken. You get a little background on that, please.
Yeah, I think, did we just skip one?
Oh, did I skip something? I'm sorry.
Oh, sorry. Am I reading? Okay.
Moving right along.
Number 3. Okay.
59 School Street. Recently issued order to correct for the state sanitary code. Chapter 2 violations. How about we get a background on that?
Okay, so, and I also have Diane Legier on board. We were both in attendance and conducted a housing inspection on June 1st. over at this property. It was at the request of the occupant who complained of several issues. We did document them and issue again that order to correct. The complaint was originally regarding stove issues with a non-working stove, mold, fire damage, and other electrical issues. So we did document those. And there was a previous history of a fire that was fairly substantial. We did have the fire department visit as well. We've asked for, the electrical issues to be inspected by a licensed electrician regarding safety hazards. I did talk to, I guess, both the owner reached out to the Board of Health. They've formally requested this hearing right now that we're having. I guess we should officially open the public hearing.
Oh.
Do we need to do that?
Can I jump in here?
Yes.
So I did speak with the owner earlier today. He had contacted the Board of Health requesting that we delay the hearing until next month's meeting. I told him that I would bring up the matter at the meeting and let him know your decision. His reasoning was that he hasn't been able to obtain an attorney at this point.
So I just want to read this section of the
Yeah, let's
housing
open this
code.
up. I think we should open it up.
Yeah, I think we should open and I'll read the section regarding the hearing.
Okay,
Okay.
so what is by motion? Let's open it up by motion. I don't even know how to do it.
Make a motion to open the public hearing. And then you
Yeah.
close the public hearing. Yeah, so yeah,
Okay.
I think so.
All right, so I move that we open up this section of I thought we were a public hearing at this point. But okay, we'll
Meeting
officially
first.
open this as a public hearing. Help us. I move that we open up this section of the hearing, this section of the meeting to a public hearing regarding 59 School Street, Apartment B11. So I need someone to second that.
Second.
And Dilip Jain in favor.
I'll second it.
Okay, and
I'm in favor.
Swati
Aye.
Sane in favor.
I am.
Okay, and Teresa, you're in favor.
Okay.
All right, so now we are now, I believe, a public hearing
Thank you.
on
Mr.
59
Chair.
School Street. The owner of the property has requested further time to obtain legal counsel, and which he can come back to the next meeting if that's how we go with this thing. Why don't we just get an update on what's going on over there, and then we can decide of whether we should continue this matter or not. How's that?
So just a quick update. So the way the housing code reads, so again, this is 105 CMR 410, which is the state sanitary code chapter 2. The order to correct this for this property, again, was issued back on June 1st. So a substantial amount of time has elapsed. Katie and the Board of Health Department received a letter from the owner of the property requesting a hearing. That is a requirement for all orders to correct, that we must, the owner has the ability to request a hearing, at which time, the board could uphold, they could revoke, they could rescind the order to correct. So that was requested, I think, the day before our previous meeting, Katie, so very close to like 30 days. It was a request in writing by a, mailed, snail mail letter. So we weren't able to get that on the books for our last meeting, and that's why it's on the agenda for today. So I just want to note that the section regarding the hearing procedures, I know we don't do this every day, so it's section .853. At the hearing, the petitioner and other affected parties shall be given an opportunity to be heard, to present witnesses or documentary evidence, and to show why an order should be modified or withdrawn, or why a dwelling should not be condemned, vacated, or demolished, or why any action or failure to act by an inspector or other personnel of the Board of Health should be reconsidered, rescinded, or ordered. Failure to hold a meeting with the time period specified shall not affect the validity of the order. I do want to just state, the concerns I have is this occupant at this property does not have a working stove. Okay, and so there are some serious electrical issues that we asked to be addressed. They have not been done within the 30 days that was, that's included in the housing code. And so I think further extension for legal representation isn't really fair to the fact that this this occupant is living without basic cooking facilities that are required under the state sanitary code. I did speak to the occupant today, right before this call. And so no repairs have been made.
None.
And so they haven't attempted, and the occupant did receive an eviction notice. And so I just want to specify that those are really two separate, like we don't get involved with evictions. We are looking truly at just the code and is there a violation? Are they currently meeting it? And so while I think we could consider, allowing an extension, we are already now 2 months past the order. So they've had over 60 days to correct, to give another 30 days. Again, we're required to offer a hearing. We offered the hearing. We confirmed it in writing with the owner, and here we are having the hearing. So.
Yeah. I have to agree. I don't see, you can have legal counsel. But as far as I'm concerned, the legal counsel is going to have to come in and say, this has got to be repaired. These things have to be repaired, whether there's an eviction notice or not. I'd like to see when the eviction came about, before or after the tenant called in. However, if the inspection was done and there's a serious health violations, such as not having a stove, and safety violations, I think we have to go forward with an order to make the corrections. So we have, what do we have? We have moisture and damage on the walls. He hasn't done anything. We have the stove. We got the moisture, loose electrical outlets, screens, light bulbs, thermostat's hanging from the wall, air handling vents, dirty and not maintained. There was the big fire. There was a fire in this itself, in this unit.
Yeah, so the story, and Diane, correct me if I'm wrong, because you spoke to the occupant as well. So there was a fire with the occupant. He did not have renter's insurance. So I think part of the appeal, and Katie, I don't know if it was listed in the reason for the petition, if they just requested, a hearing. I think there's some question as to who's the responsible party with the fire. But at the end of the day, again, we're getting back to legal, right? There's all
That's got to
different
do with the insurance. It's got
requirements.
nothing to do
The
with
stove issues have nothing to do with the fire. The fire was in the bathroom. I think there's some question as to who may be the responsible party for the fire. But at the end of the day, the housing code states that the owner must maintain certain facilities, and that would be the stove and, heating and cooling or whatever appliances were installed when they originally rented or left the apartment.
smoke detectors. There's a lot of stuff going on here. So
And-
what are our options on this, Katie? Kristen, what are we supposed to be doing
Or
with
did
this?
we, or Diane, did you have anything to add? Because you did speak to the owner. Did
Yeah,
he
Diane.
provide any further clarification?
No, but I did want to point out that the 30 days is the maximum. Items like the stove and anything that affects the imminent safety are 24 hours from the time that they receive notice.
Yep.
So those really should have been taken care of 60 days ago,
Yeah,
not 30. So there's a minor child in the apartment.
of course.
Yeah.
Well, then I think we should hold the owner of the apartment to the law, and things that are supposed to be fixed within 24 hours should be fixed within 24 hours. And things that are supposed to be fixed within 30 days are supposed to be fixed within 30 days. That's my opinion on it. There's really no questions about it. He's had plenty of time to do something. Hasn't done anything. Not one repair. Is that
Right.
correct?
And the health department has never been contacted regarding the order or, looking for clarifications. No permits have been pulled.
Yeah,
It's been total radio silent. So, my recommended course of action of the board would be to close the public hearing and to uphold the order to correct. And then we'll go through that next,
I agree.
process. So, we did, we held a public hearing, we've met the requirements, we have no documentation or correspondence as to, what they're looking to. I've had situations in housing where I can do this, but I can't do that. Can we hold a hearing and come to some mediation? But we've really been presented with no solutions or seen any progress to date.
I agree. Anyone else on the board wish to be heard?
And I don't know if there's any, Jim, comments from the public or anyone raising their hands. I don't know if we can see that feature.
Not at this time. I don't see any.
Okay. Thank you, Jim. Teresa,
Thank you.
I think you're raising your hand.
I am. So I would just note that the owner's initial request for additional time, because he wanted to secure a lawyer, came in on July 9th.
Yeah,
And given that he's had 30 days to at least find a lawyer, and given the number of lawyers available in this state, there's really no reason for him calling today and asking for more time. So I agree with the chair that this should be moving forward towards an order today. My one question is, do we have the authority, or does the town have the authority to implement fines and penalties against this individual? Because this is egregious for, this is
I agree.
substandard living for human beings, and it's just not appropriate. The biggest concern that I have are the fire detectors, the smoke detectors rather,
Right.
and the just the overall electrical conditions in that house.
Is it now? This is B11. So there's other apartments that are attached, obviously, to this, not just one apartment called B11. So there's a whole group of them. Is it all owned by the same owner?
Privately owned condos
Okay.
in the building. So,
All right.
it's this owner, I believe this is the only unit or their only property they own in town. So my next course of action, would be to contact town council. So there is a way to levy fines with non-criminal disposition, I believe, in town, and to really proceed through this. So the next step, and I guess I'd be looking for, so, with the Board of Health, we would close the public hearing, and then the Board of Health could vote to uphold the order to correct, and also to seek town council's assistance in enforcing this order and, coming to for the corrections to be made.
Okay.
So I think at the next step, because typically at this point, if we don't have a responsive, this would go to housing court. And I believe in Northborough that you guys would refer to town council to assist with representation.
And the fines are substantial. I think it's $500 a day or something
That's per violation as well.
per violation.
Per day. It can add
Per
up
day.
if they really want to go there.
I do really want to go there if we can.
Yeah, I think,
Yeah, I think that this is one of the worst cases that I've seen in a long time.
it's just so long and it's just such
Despicable.
disregard for anything, including the human beings living in there.
Right.
Okay, so we should close the public hearing. And then make a motion, or we make a motion to.
I would
go forward?
close. Yeah, I think we close the hearing and then you could
Okay.
do the motion to uphold and request town councils.
All right, the chair will entertain a motion from one of our members to close the public hearing.
I
Go
make a
ahead,
motion-
Teresa.
I make a motion to close the public hearing.
I second that motion. And all those in favor?
Aye.
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 Very good. So the public hearing is now closed. And I guess we're gonna go forward. I don't guess, I know we're gonna go forward with issuing the order to correct or face the fines and penalties that are available to us under the law, in the bylaws.
So I think we could motion, possible motion could be to uphold the order to correct
Okay,
and to request town council's assistance in enforcing it.
Dilip Jain, would you take care of that motion for us, please? Or
I make a
Teresa?
motion to,
Who's-
go ahead, Teresa.
No, Dilip, you're doing fine. Go right ahead.
Okay,
Go on.
I make a motion to enforce the order that is in place and to seek town's council representation with matters regarding fines and enforcement.
Second.
All those in favor? Aye.
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 Dr. Sani, where did you go?
I'm right here. I said aye.
Oh, I don't see her up there for some reason. I think Diane kicked you out.
I see you there.
Okay, so that's a heavy load. It's a heavy load. And they're already in housing court, I believe. Is that the end of that, Kristen? Okay, we'll move on. 101 Colburn Street. There's another one. Could you give us some background on this one, please?
Sure. So this property had a fire back in December. The fire department was called, the building inspector was called out. There was major structural damage to a large garage where they were operating, an auto body sort of activities that were occurring there. So I believe you should have all received the copy of the orders to correct back from December. And then we did revisit, and working with the building inspector, did revisit, and I issued an updated order to correct. So the original order to correct issued in December, the interior housing code violations were addressed. This is an owner occupied property. So the building inspector did give them permission to reoccupy it. So any of the immediate egress issues were addressed. But there's still substantial issues throughout the property. Again, the original order to correct was over 6 months ago. It's becoming a real nuisance for the neighborhood. The neighbors are concerned about the health and safety. There's a lot of opportunity for rodent harborage. There's trash and other materials that need to be removed, not just associated with the fire, but just the sort of the storage of materials throughout the property. The Board of Health, or I met with the building inspector and also town council. This has become a priority of the town. We've had a lot of calls and complaints from the abutters that, the status of this, if you can see the photos, it's a little upsetting to see this burnt structure that's still sitting there. So there was an email sent from town council on possible recommended action. The building department, I believe they served today. An order in the town is going to become involved with directly taking down the property. So the town can do that and then levy the cost of the repairs against the tax lien. And so the Board of Health can do that as well. And what we'd like to do is to just address this in one process. So it would likely have to go out to bid because the cost of the cleanup of the property and the removal of the unsafe structure could likely exceed $10,000. So 3 bids must be, the town must seek 3 bids, select a vendor to do this on behalf of the town. So what we don't want to see happen is they take the structure down and we still don't deal with the fact that we have like mattresses and trash throughout the back of the property. And we have to go through this. We're really hoping to sort of line up the timelines and to have the Board of Health issue the request for the nuisances to be abated. It's under chapter, I got to pull it up here on the email we have from council, and there's even a draft motion. They made it really easy. But what we'd like to do is to order the abatement of those public health nuisances. And therefore, that way the town could move forward with putting the project out to bid, making the necessary repairs to the property. This homeowner did not have homeowner's insurance, so that was a lot of the reason for the delay as to probably why, normally you have a fire and the company comes in and they clean it up right away, but this is dragged on for well over 6 months.
So basically the Board of Health's role here would be more for cleaning up the nuisance and like the hoarding stuff that's out there, not necessarily to remove the building, right? That would be the town's responsibility, correct?
So we wouldn't order the removal of the building. That's already been done by the building inspector's office. So we'll sort of stay in our lane. I mean, we sort of could, some of it gets a little messy where it overlaps a little bit with health and safety and structural. And so really the recommended action. So it's about, we already even have a drafted letter from town council. So it's about abating the nuisance. And so the recommended motion from town council would be that the board would find that the condition of the property at 101 Colburn Street, namely the junk, trash, debris, and junked vehicles located on the property, constitutes a public health nuisance in accordance with the general laws of chapter 111, section 122. So again, that would be a roll call vote. The second order would be that the board would move to direct the health agent to issue the owner of Colburn Street an order to abate the nuisance in accordance with the general laws. So we have those two motions that I could read, and we could do a simple so moved if that makes it simpler. But what we're looking at here is that, typically we'd state that we've already issued our order to correct. They've had over the 30 days, and they would receive, I believe it's like a 24-hour notice in the receipt of the order before the town could actually make the repair. So ideally, we want the homeowner to make the repairs. We don't really want to get the business of doing work on behalf of homeowners, but we just haven't made any progress. I do want to note that there was some progress made with Central Massachusetts Mosquito Control Group. I did visit the property, and I think they removed over 60 tires that were stored throughout the property. And so some progress there. We have requested on multiple occasions for a dumpster to be, at the property to remove it. We've informed them no permits required, but they haven't made any progress that we've been informed of
Is
regarding.
the property next to the senior center?
Not
close?
far, very close.
Close to that? Yeah, it's been burned down for a long time. What does the owner say? We're trying, I mean.
They pulled some I don't want to say they pulled a permit. They came and took a blank application, to start the process, but they haven't yet to make the progress.
So I saw they put a big fence up around it, like a temporary fence.
And the town did that on
Oh.
their behalf. And so again, I believe, they're already in that process where they would lien the cost of the fencing. So that was the town who will be billed for that.
I have a quick question. Kristen, is this technically a public hearing that we should have opened or no?
No, so we actually
Okay.
don't, I believe we don't have to, it's not a hearing, so it can be done at a meeting, the Board of Health.
Okay.
At least I did ask that question at town council. So
Yeah.
it wasn't told,
Yeah,
so the agenda item, it just says, and we got the agenda item exactly from council, which said it's a discussion of the condition of the property and possible declaration of decision regarding public health nuisance. It wasn't requested that it was a public hearing.
Okay, perfect. Thank you.
But again, we may want to check with Jim to see if we have any hands raised prior to, making a motion.
At this time, we have no members of the public, but again, just for, I would recommend opening and closing just, for the legal aspect of it.
Well, if town council says we don't have to open, we could use the practice.
We could. It doesn't hurt. It's one more
Usually
motion.
what
for
happens when we
Casey.
have one of these open town meetings, that's all that's on. So to have this in the middle of our regular meeting, that's what's throwing us all off, I believe. Right? We haven't had an open meeting in a
Long time.
Probably a reason to have a meeting then. Inside, right?
Okay, so let's open it up for town. I move that we open up this section of the Board of Health meeting from August 10th to a public hearing. Is that what we have to do?
For 101 Colburn
For 101 Colburn
Street.
Northborough. Okay, so I've moved it. Somebody has to second it?
I think Teresa seconded.
There we go, seconded. And all those in favor?
Aye.
It's
Aye.
unanimous.
Don't
See
forget
everybody.
roll call. You're going so far.
Do I have to do the roll call?
I'm sorry.
Philippe Jane,
Aye.
Teresa Capabianco,
Aye.
Swati Sane,
Aye.
and I, Glenn French, are all in agreement that this is now an open public meeting
Hearing.
regarding, public hearing regarding 101 Colburn Street. Thank you, Teresa. And with that in mind, I think that we've all heard what we had to hear on this thing. And if Kristen would be so kind as to read?
Well, again, I guess we'll see if there's any public input and then we
Is there
could
any, okay,
vote.
yes. Mr. DiGiulio, is there any public input?
At this time, we have no attendees in the audience.
Very good. Okay,
So we could vote to close the public hearing, and then I did just email all the motions to the 3 board members. If you'd like to, or I could read it. I don't know if either of you have your screen, you could read it from the email.
I have it on my screen here, but- Okay, so I move that we, somebody has the, Dilip Jain, could you please move to
Close the
close the
meeting.
meeting?
I move that we close the public health meeting on 101 Colburn Street.
Very good. Somebody
Hearing.
second that, please.
I second it.
Very good. All those in favor? I'm in favor. Glenn French, Dilip Jain,
Aye.
Teresa Capabianco,
Aye.
and Swati Sane.
Aye.
Okay, so that's closed. Public hearing is closed. And now we'll get on to the nitty gritty. We have to move to go forward with
Declaration, so.
declarations.
Yeah, there's 2 motions that have been forwarded.
Okay, Teresa, I'm going to ask you to take care of the presenting the motion, please.
Okay. I move that the board find that the condition of the property at 101 Colburn Street, namely the junk, trash, debris, and junked vehicles located on the property, constitutes a public health nuisance in accordance with general laws, chapter 111, section 122.
Somebody second.
Oh, I second it.
Thank you. All those in favor? Dilip Jain,
Aye.
Swati Sane,
Aye.
Glenn French, aye. Teresa Capabianco.
Aye.
Very good. That motion is passed.
Okay. I move that the board direct the health agent to issue the owner of 101 Colburn Street an order to abate nuisance in accordance with general laws, chapter 111, section 123, and to remove the nuisance if the owner does not comply with the order.
Somebody is,
I second it.
Dr. Sane, thank you. All those in favor? Dilip Jain,
Aye.
Glenn French, aye. Swati Sane,
Aye.
and Teresa Capabianco.
Aye.
Unanimous. It's so passed.
Excellent.
Good. Anything else with regards to that? Good. Okay, we can move on then to the FDA retail program. Discussion of the Association of Food and Drug Officials, AFDO, Managed Retail Program Standards Grant Program and Enrollment in Retail Program Standards. What is this all about? Kristen Black?
I'm gonna hand it over to Diane, who's, as a health inspector, she's worked through this program in another community, and it's a really great way for us to focus sort of how we're looking to improve food safety in the town of Northborough. So Diane.
Okay, Diane. Very good.
Okay, so I sent you all a little information on the grant, and basically it's a series of grants. But in order for us to be eligible, we have to enroll in this program. The really key thing is there's no downside. Once we're enrolled, we're eligible for any grant. There's 4 tiers of grants that they offer. The most recent one that Kristen and I were looking at was up to $30,000 for inspectional equipment. And these come up all the time. There's a $2,500 grant for a self-assessment. They offer incredible grants for training, and that would be for Kristen and myself. They pay for travel, for training programs. There's just really no downside to the enrollment in this program. One of the key things that I did want to point out is that 172 grants have been awarded to Massachusetts communities since 2014. I mean, so a lot of other communities are taking advantage of this program. I think we need to join them.
And so Diane, I just want to add to, so I previously, when I worked in Uxbridge, we joined this retail food standards. There's no requirement that we would meet the standards or anyone's checking on us. Or really, it just, we're enrolled, and the standards, is it, Diane, 8 or 10 key standards? I'm trying to remember.
There's actually, you're close, 9.
9, somewhere, I
Yeah,
knew it was
there
in
are.
there. But it really lets us really focus our goals for our health department and really coming up to the standards. So the goal of these standards, and really the grants let you meet the standards, they help you. So again, it's a federal program that's probably better accepted in the states that have regional health districts, but it lets you focus on different elements of food safety in your community. And so I think it's a great tool as we build up our food inspectional program to really focus our inspections in year 1. We're going to really work to meet the standards. So we're meeting the federal standards for food safety. And so it's really a playbook on how do we make sure we have like the healthiest and safest food establishments in our community. So there's no fines, there's no passing regulations. It's really this, the board would make a motion to formally enroll in the program. And by doing so, I said to Diane, we don't even need the grant money right now. We're sort of swimming in grant money, and sometimes these smaller grants take more work than they're worth. But just by being in the program, we have the access, and we can try to work towards these standards. And down the road, that $30,000, we might need it if the other state grants were to fall through. And so just being in the program, it allows us to apply. I believe it's mostly every fall. So the grants come out and they're due in September. And so it's an annual cycle. So you see the larger departments in Massachusetts are a little further along in some of these standards. So it's more of the cities, et cetera, that have gone. So it's just a stepping stone. We could provide more information, but again, there's really no commitment, no bylaw changes. It's the same food code we're all enforcing. So it's just the ability to have it there. That way we can be officially enrolled, work towards that playbook, and try to improve food safety in Northborough. And then eventually we could have access to grants to support our program if needed. The leap
Is
looks like
the
it has its hand up.
federal standards more stringent than the Massachusetts, or the other way around? Are they the same?
The other way around. So we have a merged food code in Massachusetts. So we have the federal, and then Massachusetts has some additional layers where we're stricter with a few items, but overall, we're all following the federal standards.
Kind of like a Title V situation.
Yeah, exactly. So Dilip is his hand up.
Yeah.
Oh, I see a hand up.
Question here. So, this is it's an annual grant that we have to keep applying for, correct?
Sorry, to clarify, the grants are opened annually. So every year you can apply.
Right.
There's different tiers.
Right.
You could just do your first year. I wouldn't say right now this fall, we're in the thick of Delta, so we're too busy. But let's say next year, we could apply for the assessment grant. We could receive $2,500, which maybe we could use a third party or someone to really assess where our programs are and where we should focus our inspectional services. So there's no commitment to apply, but you have to be enrolled in order to apply.
And so I'm looking at this like it's free money because we don't have to give anything back to the feds.
Right. Yeah.
Right. So there's no scrutinization of what we're doing here locally. Right. It's not like our department's going to have to create reports for them or whatever else is going to require that they're going to keep handing out this free money to us. And when I say free money, I mean, it's
Right.
too good to be
There for the
true with
taking.
those strings attached. Yeah. I mean, that's what I'm saying. Okay. That's all I need to know.
Diane, what do you think?
I am all for this. One of the other interesting things about this program is they do a mentorship program. So they pair up smaller towns like Northborough with larger communities like a Watertown or Somerville. And you kind of work in unison, share programs that work, learn from each other. And they fund all of that. They fund the time involved, they fund the travel, they fund the training. So there's just a lot of really great opportunities that will be available to us, when we're ready to take advantage of them.
It sounds to me like it's more work for your department, Diane, and for Kristen herself. So am I right on that, or is there somebody else that we're missing?
Well, that's if we choose to do it, right? There's no penalty if we don't. So we can enroll, and right now I'd be saying I have no time
Right,
for it. Diane, if you
right.
want to build that into your programming, we'd be pushing this down the road a bit. But I think just introducing, know it's available, like formally being accepted, then you're on the newsletters, you're getting that guidance and documentation. So it's just it's a stepping stone. So it's
Okay.
not required. If time doesn't allow, no federal inspector is going to come out and tell us we haven't met our commitment. There's no
Right.
commitment letter to sign, or,
Okay.
it's really just that we would want the board to.
So it's
vote
just a
for it.
program
Mhm.
that could come in handy in the future, and we should get onto it now just to get our foot in the door, and then we can work on that. And if we need grant money, we'll take the grant money. If we don't need the $30,000 grant money, then at least we get the $2,500 to sort of move our department
Mm-hmm.
along.
Correct.
Well, that sounds fair to me. Does anyone else have anything to say about that?
I do have a question. Is there really any downside to becoming part of the program?
No.
I mean,
No.
if there's no downside and then you have these potential opportunities available, it's
Right.
just like a no-brainer.
Yeah. I think what happens sometimes if you're not enrolled and then you miss the grant deadline, you don't want to hold an emergency meeting because we forgot about it. So the whole idea is like,
Okay,
well, the grant came through and I said, oh, let's just get on the agenda before we forget about it, because it's just one of those things, so they want you to be fully enrolled prior to applying. So we'd just be in a good position for next year. Then we're officially listed and we just get that support. So yeah, I don't see any downside. There's many Massachusetts communities that have enrolled. I think it's all about how much staff time they have to really dedicate, but there's no
Right.
requirement to make progress, so.
okay. The worst they can do is kick us out.
Worse places than that.
Okay, well, we need a motion for this too.
We do.
Okay, the chair will entertain a motion from the board to allow us to join the FDA retail program.
You want me to do it?
Sure.
I
do
make a
want you to do
motion.
it.
Sure. I make a motion that the town of Northborough participate in the FDA retail program as discussed today.
Somebody second that, please.
I second it.
Good. All those in favor? Teresa,
Aye.
Swate,
Hi.
Glenn, aye, and Dilip.
Aye.
Very good. Remember, Kristen, Katie, make sure you got the names the same all the way through this whole meeting. I know I'm playing around with names, but we're just getting my first day. Moving on, Public Health Emergency Preparedness, otherwise known as PHEP, P-H-E-P, Region 2 voting members. Tristan, what is this all about?
Yeah, so each year you're supposed to officially designate your voting members for FEP Region 2. And so it's a 74 town, there's, I forget how many regions, there's 4A, 4B, it's all broken up strange, but we're part of the, central Massachusetts based out of Worcester, FEP Region 2. So you have 2 voting members. The meetings are held once a month. And so anyway, you have 2 voting members. I believe I'm your voting member because I've been voting for you. So I guess we got to get official. I don't know how I think we might've done that a while ago, but each year they ask you to like re-up your letter. I don't even know, Katie, I don't know if you have an answer, if we even have a secondary member, if you guys have voted the meetings. So
That I know of.
okay.
I know.
So the meetings, I'll be honest, I'm vice chair on this group. They're very dry meetings. It's a lot about purchasing public health emergency equipment and supplies. Everything from the mobile vaccination use, some of the tables or cones, or we can request PPE. So the meetings have been a lot easier since COVID because we've been holding them remotely. Prior to that, participation was way down because in 74 communities, you could be driving over an hour and a half if a northern community at the New Hampshire line attended. We're hoping they'll stay remote, but again, they're held, I believe it's the first Thursday of each month is when these meetings are held, and they run from about 9 to 11 a.m. So I'm hoping that I can continue to serve as your voting member, so I can continue to chair FEP Region 2. Now that we have another staff person, Diane, it may be helpful to designate her as a backup. Sometimes, like the Northborough Health Department, we could request an ID badge printer, or we may need cones, or we may want a a refrigerator or something like that that would fall under emergency supplies. So someone would need to be present at a meeting if you were to request items. So that is a requirement. It also, it can pay for mobile plans. So I believe the iPad we have now, the FEP Region 2 pays for it. So we just always have to make sure there's somebody there to vote it so we can get those reimbursements. So we could open it up to members if you're interested, but it is a very dry meeting if you want to be a voting member, but I know Diane is willing to serve as a backup as well.
I'm good.
Sounds good to me.
Sounds wonderful.
Perfect.
Diane.
Okay. So I guess we would just need a formal motion to designate, Kristen Black as your primary and Diane Legier as your secondary voting member for FEP Region 2.
Okay. Dr. Jane, Dilip Jain, will you take care of this motion for us? We're on a
Sure.
roll.
I make a motion to nominate Kristen Black as our primary member and Diane Leger as our backup member to the Public Health Emergency Preparedness Region 2.
Somebody
Committee.
second that, please.
Second.
All those in favor? Teresa,
Aye.
Swati,
Aye.
Dilip,
Aye.
Glenn, aye. Unanimous. So passed. Is there anything else, Kristen, before we move to close this meeting?
Establish a future tentative meeting date. It's penciled in as September 14th right now, which is the second Tuesday at 6 p.m. So as long as we're set to stick with that.
Yeah.
There's no objections. You could do a motion to close the fun
I
fast
move
month.
that we close this meeting of August 10th, 2021.
I second it.
Very good. All those in favor?
Aye.
Dilip Jain,
Aye.
Teresa
Aye.
Capabianco,
Aye.
Swati Sane,
Aye.
and myself. Very good. Thank you very much.